As lead bishop in the Church of England for Health and Social Care, it's a tremendous pleasure and a privilege for me to be able to wish the NHS a very happy birthday on its 70th anniversary. I think we're all conscious of the wonderful work that has gone on over those 70 years. The NHS is rated as one of the best health services in the world, and those of us who've had any kind of emergency or medical difficulty will know just what marvellous treatment normally has been provided. So today is a day for celebration. It's a real opportunity to say thank you to all the many people, and there are 1.4 million of them in this country, who work for the NHS so tirelessly and brilliantly, and to say thank you for the wonderful work that they do. But I think we're all conscious of the fact that as we grow older as a nation, and as we develop what are rather unappealingly known as multiple morbidities, there are going to be all kinds of challenges in the future. I had the privilege recently of sitting on a parliamentary select committee looking at the long-term sustainability of the NHS, and we came up with a whole number of proposals, some of which we're going to be debating at the General Synod of the Church of England in York in just a few days' time. One of those was, of course, that it does need more money. The Prime Minister has already responded to that and offered more money, and that's very welcome indeed. But of course the money will have to come from somewhere, and we need to be prepared, I think, as citizens, probably to pay more tax in the future. Not a welcome message, but an important one, if we want the NHS to go on providing what it has so well in years to come. But it's not only a matter of money. Another really important issue is that of integration. There's a debate in the House of Lords in which I'll be taking part, which will be looking at this question of integration, the integration of health, of social care, and also of public health, and in particular looking at the slightly unequal outcomes at the moment for those with mental health problems and those without. Integration is absolutely crucial as we look ahead, and one of the findings of the Select Committee was that we are in danger of short-termism, not least because it's such a political issue at the moment, and we need to be looking 20, perhaps even 30 years ahead. So integration is one thing, public health and prevention is another. And our finding was that as citizens of this country, we need to be taking more responsibility for our own health. This relates to all kinds of issues like obesity, smoking, alcohol, and so on, all of which cost the nation vast sums each year. So it's not just a matter of saying, national health, get your house in order, and we're looking to you to solve all our problems. It's also up to us, I think, to take responsibility for our own bodies as temples of the Holy Spirit, and to use them wisely and well in ways that make the National Health Service a wellness service, not just a sickness service.